So very good morning everyone. I am Dr. Satyabrata, MDDM clinical pharmacologist, and today I am going to discuss on uses of glucocorticoids with special emphasis on non-endocrine uses. So I will talk on introduction, classification, mechanism of action of glucocorticoids, uses and adverse effects, and lastly conclusion. So you all know that glucocorticoids carbon 21 atoms are the products of adrenal cortex, and cortisol is the main glucocorticoid in humans, and the release of glucocorticoids follows a definite circadian rhythm, and that is highest in morning, lowest during evening hours, and is pulsatile in nature. Then this is the HPA axis and adrenal cortex. You know that various stimulus stimulate hypothalamus, then in hypothalamus CRH release, that is corticotropin releasing hormone, then from it anterior pituitary stimulated and it releases the ACTH adrenocorticotropical hormone, then adrenocorticotropical hormone stimulates the adrenal cortex to produce the glucocorticoids, and then the glucocorticoid has inhibitory effect on anterior pituitary and hypothalamus. So you all know that there are three layers in adrenal cortex, adrenal gland, that is adrenal cortex, adrenal medulla, and the cortex comprises of zona glomerulosa, zona fasciculata, and zona reticularis, and from the zona glomerulosa mineralocorticoids are released. From the zona fasciculata glucocorticoids are released, that are cortisol and corticosterone, and from the zona reticularis the adrenal androgens like DHEA, dihydroepiandrosterone sulfate are released, and from the adrenal medulla the catecholamines epinephrine, norepinephrine are produced. So coming to the synthesis of glucocorticoids, from cholesterol the zona fasciculata produce cortisol and corticosterone. From the zona glomerulosa aldosterone is synthesized, and from the zona reticularis androstenedione is released, and there is showing the pathway of the synthesis of these cortisol, corticosterone, aldosterone and androstenedione. You can go through this image and go through the books also to learn more about this. Then coming to the classification of glucocorticoids, there are many types like short acting, which acts less than 12 hours. For example, cortisol and hydrocortisone. Cortisol has anti-inflammatory potency is 1, mineralocorticoid potency is 2, and equivalent dose is 20 mg. Hydrocortisone, the anti-inflammatory potency is 0.8, mineralocorticoid potency is 2, equivalent dose is 20 mg. Then another class is intermediate acting, that acts from 12 to 36 hours. For example, prednisone, that its anti-inflammatory potency is 4, mineralocorticoid potency is 1, equivalent dose is 5 mg. And prednisolone, its anti-inflammatory potency is 4, mineralocorticoid potency is 1, and equivalent dose is 5 mg. Then triamcinolone, its anti-inflammatory potency is 5, mineralocorticoid potency is 0, and equivalent dose is 4 mg. Then methylprednisolone, anti-inflammatory potency is 5, mineralocorticoid potency is 0.5, and equivalent dose is 4 mg. Then fludrocortisone, its anti-inflammatory potency is 15, mineralocorticoid potency is 200, and equivalent dose is 1.4 mg. Then coming to another class, that is long acting, that acts more than 36 hours. Betamethasone, for example, betamethasone, its anti-inflammatory potency is 25, mineralocorticoid potency is 0, and equivalent dose is 0.75 mg. Then dexamethasone, its anti-inflammatory potency is 25, mineralocorticoid potency is 0, and equivalent dose is 0.75 milligram. Then another class is inhaled glucocorticoids. That is, for example, beclomethasone dipropionate. Its anti-inflammatory potency is 8 pops 4 times a day equals 14 milligram, and oral prednisone once a day. So this is the classification of glucocorticoids. Then coming to the mechanism of action of glucocorticoids, you all know that acts through the nuclear receptor and leading to the altered cellular function, protein synthesis, and leading to the altered cellular function. And glucocorticoid target the cortisone. This image shows the production of mechanism of glucocorticoids, and you can go through the books how it works through the nucleus, how it works on the nuclear receptor. You can go through the books and articles to learn more about this. Then transactivation effects like metabolic actions of glucocorticoids. Glucocorticoids increase the blood glucose, protein catabolism, fatty acid production, and peripheral fat distribution. So glucocorticoid can cause uh, hyperglycemia, understand, diabetes like features. So electrolyte effect, it can increase, the glucocorticoids can increase the sodium retention, potassium excretion, calcium excretion, and decrease absorption from the gut. So glucocorticoids can cause osteoporosis also. Then cardiovascular system. Cardiovascular system, it is involved in vascular remodeling, increases sensitivity to vasoactive substance. Then in CNS, central nervous system, it can cause behavioral changes, memory, brain excitability, and sleep. It can affect the memory, brain excitability, and sleep. Then in hematological system, it decrease in lymphocytes, neutrophils, eosinophils, basophils. And in musculoskeletal system, it lead to protein catabolism, that release of amino acid, and that lead to excess amino acid lead to steroid myopathy and increased osteoclastic effect. Then transrepression effects, mostly due to protein interaction between the glucocorticoid receptors and transcription factors NFKB and AP1. Repression of expression of genes encoding a number of cytokines that play an important role in immune and inflammatory network, along with COX-2, NOS2 gene. Then reduced interleukin 1, 2, 3, 6, 8, 12, interferon gamma, prostaglandins, PGs, and TNF alpha, that is tumor necrosis factor alpha, GM-CSF, granulocyte macrophage colon stimulating factor, then cytokines, and that decreased in fibroblast, GAGs, and collagenase function, increased anti-inflammatory factors, interleukin 10 and annexin 1. Then anti-inflammatory and immunosuppressive actions is shown in the figure, that anti-inflammatory effects like leukocyte accumulation, decreased leukocyte function, monocytopenia, eosinopenia, decreased complement components, decreased histamine mediated reactions, and immunosuppressive effects like decreased lymphocyte and monocyte function, monocytopenia, and decreased complement levels. Then the uses of glucocorticoids in endocrine system. The glucocorticoids can be used in acute adrenal insufficiency. After maintaining adequate hydration with NaCl sodium chloride solution and 5% glucose. Bolus of 100 mg IV hydrocortisone is given, and then it is maintained as continuous infusion of 50 to 100 mg every 8 hours. When patient stabilizes, dose of hydrocortisone is decreased to 25 mg every 6 to 8 hours, and thereafter the dose is maintained according to uh, chronic adrenal insufficiency. Then glucocorticoids can be used in chronic adrenal insufficiency. Oral hydrocortisone 20 to 30 mg per day is given in divided doses, and glucocorticoids can also be used in congenital adrenal hyperplasia. Oral hydrocortisone 0.6 mg per kg is given daily in 2 to 3 divided doses. Then what are the non-endocrine uses of glucocorticoids? We can use glucocorticoids in rheumatic disorders and vasculitis syndromes. Mainstay of treatment in inflammatory rheumatic disorders like rheumatoid arthritis, systemic lupus erythematosus, PAN, polyarthritis nodosa, then Wegener's granulomatosis, Churg-Strauss syndrome, giant cell arthritis. Coming to rheumatoid arthritis, oral prednisone started at 5 to 10 mg per day with DMARDs, that is disease modifying anti-rheumatoid drugs like sulfasalazine, methotrexate, etc. If acute exacerbations happens, then higher doses of prednisone 20 to 40 mg per day is given, followed by tapering thereafter. When one or more than one joints involved, injection triamcinolone 5 to 20 mg can be given intraarticularly. In case of SLE, systemic lupus erythematosus, high-dose short-duration glucocorticoids, the mainstay of treatment for any life or organ-threatening inflammatory conditions in SLE, systemic lupus erythematosus patients. For severe disease, oral prednisone 0.5 to 1 mg per kg per day is given for 4 to 6 weeks, or IV methylprednisolone sodium succinate 500 to 1000 mg given daily for 3 days. In lupus nephritis, IV methylprednisolone 500 to 1000 mg is given daily for 3 to 5 days. Then in Wegener's granulomatosis, oral prednisone 1 mg per kg per day is given per first month, followed by gradual tapering on alternate day or daily for 6 to 9 months. Then giant cell arteritis, oral prednisone 40 to 60 mg per day for 1 month, followed by gradual tapering of dose. If ocular symptoms plus, then oral methylprednisolone 1000 mg per day for 3 days is given. Others uses of glucocorticoids like tendinitis, bursitis, tenosynovitis. Then musculoskeletal disorders. Inflammatory myopathy. Inflammatory myopathy, oral prednisone is the treatment of choice initially. High dose prednisone 1 mg per kg per day is given as early as possible. Then after 3 to 4 weeks, prednisone tapered slowly over a period of 10 weeks to 1 mg per kg every alternate day. In myasthenia gravis, oral prednisone 15 to 25 mg per day given as single dose, then dose is increased by 5 mg per day in 2 to 3 days interval till 50 to 60 mg per day is reached, and continued for 1 to 3 months, and it can improve the muscle weakness. Then pulmonary disease, bronchial asthma. Glucocorticoids are used via 3 modes, oral, IV, intranasally. Mainstay for long-term treatment in bronchial asthma due to its anti-inflammatory effect. In severe asthma, IV methylprednisolone 60 to 120 mg every 6 hours used initially, followed by daily oral dose of prednisone 30 to 60 mg as acute attack resolves, and then tapered gradually over next 10 days to 2 weeks. If less severe asthma or acute flares of COPD, chronic obstructive pulmonary disease, then Brief course of oral prednisone 30 to 60 mg is given for 5 days. The inhaled steroids are now first-line treatment for persistent asthma uh, and rapid decrease in bronchial hyperactivity and inflammation as compared to oral glucocorticoids. For example, cyclosonide, alfesco, and beclomethasone dipropionate beconase AQ are used intranasally. Then interstitial lung disease, oral prednisone 0.5 to 1 mg per kg per day, once given for 4 to 12 weeks, and when patient stable, then decreased to 0.25 to 0.5 mg per kg for 4 to 12 weeks. Then antenatally, glucocorticoids are frequently used in the setting of premature labor to decrease the incidence of RDS, respiratory distress syndrome, and IBS, hemorrhage. Dose is injection betamethasone 12 mg IM, that is intramuscular, every 24 hours for 2 doses, or injection dexamethasone 6 mg IM intramuscular every 12 hourly for 4 doses is given to women with definite signs of premature labor between 26 to 34 weeks of gestation as a single course. Other uses of glucocorticoids are bronchopulmonary other uses of glucocorticoids are bronchopulmonary aspergillosis and aspiration pneumonia. Then renal disorders, nephrotic syndrome. First line treatment in patients with nephrotic syndrome secondary to minimal changes disease with excellent prognosis. Dose is 1 to 2 mg per kg of prednisone is given for 6 weeks, followed by a gradual tapering of dose over 6 to 8 weeks. 85% of patients have decreased proteinuria within 2 to 3 weeks, and more than 95% patients have remission within 3 months. MGN, MPGN, FSGS are also giving a trial of glucocorticoids. Then in MGN, alternate day therapy of oral prednisone 120 mg for 8 to 10 weeks is given, followed by 1 to 2 month period of tapering. MGN means minimal change glomerulonephritis. Then allergic diseases. In patients with allergic disease of limited duration, for example, hay fever, serum sickness, urticaria, contact dermatitis, drug reaction, sting, angioedema, glucocorticoid supplement is given along with primary treatment. In cases of severe disease, 125 mg IV methylprednisolone is given every 6 hours. In case of anaphylaxis, IV methylprednisolone 0.5 to 1 mg per kg is given to relieve bronchospasm. Then in allergic rhinitis, intranasal steroids, beclomethasone, budesonide, fluticasone are regarded as drug of choice. Then in infectious diseases used in very limited settings like AIDS, acquired immunodeficiency syndrome patients with pneumocystis carinii pneumonia, and moderate to severe hypoxia, addition of glucocorticoids to antibiotic regimen increases oxygenation and lowers incidence of respiratory failure and mortality cases. Then H. influenza, Haemophilus influenza type B meningitis in infants and children of more than 2 months of age. Glucocorticoids decreases incidence of long-term neurological impairment. Then in septic shock, low-dose glucocorticoids 100 mg of hydrocortisone every 8 hourly can be given during early course of disease. Decrease systemic and tissue inflammation, restores cardiovascular system and other organ function, prevents death. Current guidelines suggest hydrocortisone can be given to adult patients with septic shock whose blood pressure fails to respond to vasopressors and fluids. Then ocular diseases. Glucocorticoids used frequently to suppress inflammation and to preserve eyesight when used properly. topically given when outer eye or anterior segment is involved, and intraocularly or systemically given when posterior segment involvement is there. For anterior segment, 0.1% dexamethasone sodium phosphate solution, 2 drops in the conjunctival sac every 4 hours while awake, and 0.05% dexamethasone sodium phosphate ointment at bedtime is given. For posterior segment, 30 mg of prednisone orally per day given in divided doses. In Graves' ophthalmopathy, when moderate active disease present, pulse therapy with IV intravenous methylprednisolone 500 mg once weekly for 6 weeks, then 250 mg once weekly for 6 weeks is given. Decreases the inflammation and improves muscle weakness. Caution: topical therapy increase intraocular pressure in IOP in glaucoma patients, so IOP intraocular pressure should be monitored when glucocorticoids are used for more than 2 weeks. Others like scleritis, episcleritis, retrobulbar neuritis, and corneal graft rejection. Other uses of glucocorticoids are scleritis, episcleritis, retrobulbar neuritis, and corneal graft rejection. Then contraindication. What are the contraindications of glucocorticoid use? In herpes simplex virus keratitis, HSV keratitis, glucocorticoids use may lead to irreversible clouding of cornea and further loss of eyesight. So, glucocorticoids should be contraindicated in HSV keratitis. And in mechanical lacerations and abrasions of eye, glucocorticoids to be contraindicated because they delay healing and promote spread of infections. Skin diseases efficaciously used in several inflammatory dermatosis cases like eczematous eruption. 1% hydrocortisone ointment is applied locally twice daily. In case of pemphigus vulgaris, 1 mg per kg per day of prednisone is given daily systemically for 1 to 2 weeks along with other immunosuppressive agents. In case of contact dermatitis, oral prednisone 1 mg per day is given followed by tapering over next 2 to 3 weeks. In case of seborrheic dermatitis, topical glucocorticoids like clobetasol or betamethasone used. In case of Stevens-Johnson syndrome, oral prednisone 1 to 2 mg per kg useful in early disease. In case of candidiasis, if inflammation present in skin, then mild glucocorticoid lotion or cream 2.5% hydrocortisone can be used. Then other uses of glucocorticoids in skin disorder like bullous pemphigoid, atopic dermatitis, lichen planus, psoriasis, systemic sclerosis. Then coming to topical steroids. Topical steroids are classified into highest efficacy like clobetasol propionate 0.05%, halobetasol propionate 0.05%. Then high efficacy betamethasone dipropionate 0.05%, difluorouracil diacetate 0.05%, fluocinolone acetonide 0.2%, and others. Then intermediate efficacy topical steroids are clobetasol butyrate 0.05%, hydrocortisone acetate 2.5%, fluocotolone 0.025%, and others. Then low efficacy topical steroids are hydrocortisone butyrate 0.001%, hydrocortisone acetate 0.1%, methylprednisolone acetate 0.1%. Then use of topical steroids in case of allergic conditions, infections like bacterial, viral, fungal, pigment disorders, psoriasis, eczematous disorders, drug-induced disorders, etc. But with cautions. Systemic agents mainly used for serious conditions not responding to other treatment, for example pemphigus and exfoliative dermatitis. Then gastrointestinal disorders, GIT disorder like inflammatory bowel disease, Crohn's disease and ulcerative colitis. Glucocorticoids used in patients who fail to respond to conservative management, rest, diet, sulfasalazine. In mild ulcerative colitis, hydrocortisone 100 mg is given as retention enema. Severe acute exacerbations, oral prednisone 10 to 30 mg per day frequently given. For severely ill patients, larger doses of prednisone 40 to 60 mg per day is given. Oral budesonide entocot 9 mg per day is used for 3 months and then tapered. Then glucocorticoids are effective in moderate to severe Crohn's disease (CD), Crohn's disease inducing 60 to 70% remission. For treatment, oral budesonide 9 mg per day is used for 2 to 3 months and then tapered gradually. For relapse reduction, oral budesonide at a dose of 6 mg per day over 3 to 6 months. In hepatic disorders like autoimmune hepatitis, oral prednisone 40 to 60 mg is given daily initially with tapering to a maintenance dose of 20 mg daily after serum transaminase levels fall. Alternate therapy with oral prednisone 30 mg per day plus azathioprine 50 mg per day given and then prednisone decreased like to dose like 10 mg per day over a month. 80% of patients show remission. In severe hepatic disease, use prednisolone instead of prednisone. Then alcoholic liver disease. Patients with severe hepatitis, oral prednisone 40 mg per day or prednisolone 32 mg per day is given for 4 weeks followed by tapering for next 4 weeks. Autoimmune pancreatitis, oral prednisone 40 mg per day for 4 weeks followed by taper of daily dose of 5 mg per week is done based on clinical parameters. Glucocorticoids can decrease size. It can decrease size of pancreas, improvement in histological features. Then CNS disorders, central nervous system disorders like cerebral edema. Glucocorticoids decrease edema associated with parasites and neoplasms, especially metastatic ones. Then in case of Bell's palsy, along with acyclovir, glucocorticoids like oral prednisone 60 to 80 mg per day is given for 5 days and then tapered over next 5 days. Then other miscellaneous conditions where glucocorticoids are used like sarcoidosis. In sarcoidosis, glucocorticoids used in life-threatening forms. And patients with severe pulmonary involvement, 10 to 20 mg per day prednisone is given to induce remission. Maintenance dose of 5 mg per kg is given thereafter. When associated with TB, tuberculosis prophylactic ATT should be given. Antitubercular therapy. Then thrombocytopenia, oral prednisone 0.5 mg per kg per day is used to decrease bleeding tendency. Then autoimmune destruction of erythrocytes, hemolytic anemia, prednisone 1 mg per kg per day is given. In severe hemolysis, dose is increased and then tapered gradually as anemia improves. Then organ transplantation, high dose prednisone 200 to 300 mg is given immediately before or at the time of transplant surgery and then decreased 30 mg within a week. In acute rejection, 0.5 to 1 mg IV methylprednisolone is given immediately upon diagnosis and continued OD once daily for 3 days. Then spinal cord injury, life-saving when used within 8 hours of injury. Act via decrease the free radical induced neurological injury. Dose is methylprednisolone, sodium succinate 30 mg per kg initially followed by infusion of 5 to 4 mg per kg per hour for next 23 hours. Then hypercalcemia in malignancy act by increasing calcium excretion and decreasing its gut absorption. There's multiple myelin Hodgkin's lymphoma, leukemia, carcinoma breast. Oral prednisone 40 to 100 milligram in 4 divided doses is given over several days along with calcium level monitoring. Then coming to the major side effects. Major side effects with corticosteroid therapy. Dermatologic and soft tissue like skin thinning and purpura, Cushingoid appearance, alopecia, acne, hirsutism, stria, hypertrichosis. In eye, posterior subcapsular cataract can occur, elevated intraocular pressure of glaucoma, exophthalmos. In cardiovascular system, hypertension can occur, perturbations of serum lipoproteins, premature atherosclerotic disease, arrhythmias with pulse infusions. In case of gastrointestinal system, gastritis, peptic ulcer disease, pancreatitis, steatohepatitis, visceral perforation can happen. In renal system, hypokalemia, fluid volume shifts can occur. Genitourinary and reproductive system, amenorrhea, infertility, intrauterine growth tests can occur. In bone system like osteoporosis and avascular necrosis can happen by use of glucocorticoids. Muscle myopathy, glucocorticoids can lead to myopathy. And neuropsychiatric can cause euphoria, dysphoria, depression, insomnia, akathisia. Then psychosis, pseudotumor cerebri can happen due to corticosteroid use. Endocrine system, diabetes mellitus, hypothalamic pituitary adrenal insufficiency can occur due to corticosteroid use. Then infectious disease like heightened risk of typical infection, opportunistic infection, herpes zoster can occur with use of corticosteroids. So that's all for today. We'll meet on another day. If you have any question, then you can ask in the comment box and I will try to give the answers. And you can also go through different books and articles to learn more about this glucocorticoid uses. So thank you very much. Jai Jagannath.